Okay. So I'm gonna ask you questions, guys. I expect انكم you answer في الchat. طبعا for any question you can stop me at any time and just ask me, huh? Just give me a second, I'm still admitting people. طيب, بسم الله الرحمن الرحيم. So we're gonna talk today about ECG 101. So what my objective today is, I'm gonna review the basics of ECGs with you guys. I'm gonna give you a systemic way of reading the ECGs, and I'm gonna tell you a little bit about STEMI mimics, which I think is important. So what is it and what's an ECG? So basically, ECG is an electrocardiogram representing any electrical events in the cardiac cycle. So every depolarization or muscle contraction, it's represented by an electrical event that can be captured by ECG. So each event, each contraction of the muscle is a distinctive waveform that you can see. And the studies of these waveforms tells you a lot about the heart and cardiac pathology. So that's why an ECG is an importance. So depolarization, so it's the contraction of muscle cells, as we said, and associated with electrical activity, this electrical activity called depolarization. These changing can be seen by the electrodes attached to the body surfaces. Okay, so what's the pacemakers of the heart? I think you know it by now, so answer me in the chat. على بال ما أدمت الباقيين. So I'm still for you guys. So which are pacemakers of the heart? Do you know them?
ايوه دكتور، بديل الاس اي نود.
SA node. Okay, that's good. SA node وش بعد؟ ما في شيء اسمه SV node. So we have an SA node, and we have also, as Hassan says, is AV node. Yeah, so the SA node send impulses that goes through the electrical system. So you're right, guys. So we have the SA node, which is the dominant pacemaker. We will have intrinsic rate of 60 to 100. Intrinsic rate, yani its usual rate is from 60 to 100 beats per minute. But then our next thing is the AV node, okay, which is the backup basics of the backup pacemaker of the heart. And it's usually have an intrinsic rate of 40 to 60. بعدين آخر شيء اللي هو ventricular surge with Purkinje fibers, and their rate is 20 to 45. So إيش depolarization? So هذه standard calibration. So every ECG sheet, you'll find it every 25 millimeter equals 1 second. هذا في length لما تشوفها في العرض. Okay. Every point millivolt is a millimeter. So basically 1 millivolt is two big squares. هذا في الطولي. Okay. And electrical impulses that travels toward the electrode produce a bright or positive deflection. إيش معنى هذه? So imagine here's the heart, okay? And your electrode is here. في هذه الجهة. It measures from negative, هنا negative, هذا positive. So you're gonna have a positive deflection in the ECG. If your electrode is here, because لأن الwave or يعني electrical impulse is going away from the electrode, it's going to have a negative deflection. This is when it comes perpendicular. So the R to the S is exactly at the same. So the same R is the same S. I'm going to explain this a little bit more next. So as we said, the conduction, what it happens. So it starts here. So at the red atrium is your SA node. So you get an impulse that goes all the way down to your AV node, which is at your atrial ventricular septum and the valve here. And then the AV node will take the impulse and move it to your Purkinje fibers, then your muscle cells. And that's gonna have the P, QRS, and T wave. Do you know what's P represents? أحد يعرف? So what is it P? P represents what? So the P wave, which exactly? So P is atrial depolarization. QRS.
Ventricular depolarization.
Ventricular depolarization. And the T wave.
Repolarization of the ventricle.
Yeah, so it's repolarization. So it's ventricular repolarization. طيب ليش ما عندنا P wave repolarization? Sorry, let's go back. ليش ما عندنا wave atrial, sorry, آسف, repolarization. I think still people coming in. Okay. So why we don't have atrium repolarization? ليش ما عندنا wave رابعة؟ Basically, it's going to be embedded in QRS. عشان كذا we don't see it. يعني لأن QRS is a bigger, so it's going to be embedded. That's why we don't see it usually. Exactly. So Ahmed, I think, answered that. Okay, so this is the ECG paper. So every small box, the horizontal represent time added and what we call, okay? And these times, so every small had big squares, huh? So every big square contained 5 small squares. So every one small square is 40 milliseconds or 0.04 seconds, okay? And every one large square is 200 milliseconds or 0.2 seconds. So the horizontal squares في ECG or boxes is representing a time. The ventricle, so vertically they represent what? Voltage or power. Okay, and every one large box, as we said, is 0.5 millivolts. While every small box vertically is 0.1 millivolts. Okay. طيب. At the ECG عندنا 12 leads, 3 standard limb leads, 3 augmented limb leads, and 6 precordial leads. Do you know how the ECG happens? Do you know where you attach and how it happens? So yalla, I want you to talk, guys. Do you know how to do the ECG? How to attach stuff, the electrodes? Yusuf. طيب يلا Yusuf. Take the mic and tell me how.
السلام عليكم.
وعليكم السلام.
دكتور قصدك اللاترال والانفيريور
لا هذه البوزيشن of the heart. تعرف how you put the electrodes على البادي? Where do you put them? How they put them?
Okay. من ال V1 until V6 we put it in the anterior side. V5, V6 laterally, and V2 and V3 and AVF inferiorly, and V1 and AVL lateral, in the lateral side.
صحيح. Yeah, that's true. That's how they look at the heart. It's not that how you attach the electrodes. فالحين we have one important distinction. So there's one important distinction we need to understand. فعندنا شيء اسمه electroids شيء اسمه leads صح ولا لا؟ electroids عادة we usually mix them, but electrodes عبارة عن الأشياء اللي we attach it to the body هذه الأشياء. So عبارة عن electrical stuff or اللي we attach it to the body. The leads it's the ECG leads اللي هي what we see في على ECG paper from V1 to V2 would have the waveform حق ECG. Let me just delete that. Just one second. That's an important distinction. فلما أقول لك electrodes غالبا I mean the same wires we attach to the body, okay, and that's how we see the heart. Okay. عندي 1 second. Let me put my iPad. خليه الhost. Give me a second. Make a host. Changing host. Okay. So basically, I am the host now. So let's stop share here. And let me. Okay. شوفون الوايت بورد هل هو واضح؟ Yeah, I guess so. So let's start. So let's start seeing ECG. So مثلا let's have this guy. طبعا I'm bad at drawing بس يعني سلكولي. ف basically بتجي we call it limb leads. We have 6 limb leads صح ولا لا؟ وعندنا 6 precordial lead. إذا الصوت مو واضح if there's any problem please let me know. Okay. ف how are we gonna attach them؟ فعندنا 4 electrodes. واحد على left arm. We're gonna attach على الأند على كذا على اليد. Just the distal forearm also عندنا right arm. And then a left foot and then a right foot. Okay. Hina, that's the heart. Okay. So what are we gonna do is so جاء واحد اسمه Einthoven. قال you know when I attach these leads I'm gonna do assumptions عشان أشوف ال ECG. Okay. So we understand where we attach them. So our limb leads is gonna attach to our our limbs على right arm, left arm, على distal ends وعلى left foot و right foot. فإحنا قلنا عندنا right arm lead هنا left arm lead. هنا the heart, so we're gonna look at the heart. So this is the heart. Okay. وعندنا غالبا تحت هنا sorry the left, we have the left foot lead. طبعا الرايت foot غالبا نخليه negative لأنه ما it doesn't measure anything. Okay. فجاء Einthoven وقال I'm gonna do an assumption. هذه leads I'm gonna make one is negative, one is positive. Okay, and I'm gonna measure what's happening in the heart. But this is your أول lead اللي هو lead 1. Okay. So he assumed this is negative, this is positive. But then he assumed your right arm is negative and left foot is positive. So you have lead what? Had that 3. But then your left arm is negative, left foot is positive, and this is lead 2. Okay. And then so you just give me a second. perfect. فهذا Eindhoven. So نسميه Eindhoven's lead. جاء واحد اسمه Goldberger. قال you know I can add another 6 lead. فايش سوى؟ فجاء هنا قال left arm, right arm, left foot. Okay. طبعا هنا الهارت. Okay. فقال أنا باخذ الأفريج السم between them and I'm gonna calculate it as a negative. فجاء هذا الأفريج هذا كله حسبه as a negative. حط لك هنا lead وسماه augmented limb lead L. بعدين جمع هذا الاثنين هذا as a negative. هنا مر على الهارت وهذا augmented limb lead foot. جمع هنا خلاه negative خلاه يجي هنا heart. بعدين هذا augmented limb lead right. Okay. Is it clear؟ فهذا Goldberger. Okay. فطلع شيء اسمه hexaxial system. So let's put them back. Let's put all that together. نمسح هذا نمسح هذا. اختار لون أفضل. احنا ايش قلنا؟ طلع شيء اسمه hexaxial. فعندنا lead 1 هنا. قلنا lead 2 يجي شكلها زي كذا. عندنا هذا هنا AVF. هنا lead 3. اوكي. وعندنا هنا AVL. عندنا وش كان باقي هنا AVR. Okay. So this is how they created the limb leads. فعندنا 4 electroids that attach your body. بعدين منها طلعنا limb leads. طلعنا كم limb lead؟ عندنا 6 limb leads. Okay, so let's go back to the presentation. Give me a second. Stop share. Participants. Is it clear? Any so far? نشوف. Okay. So let's move on. So basically احنا هذا اللي قلناه. So this is representation of the same thing I drew. So you have your right arm electrodes, your left arm electrodes, and your left leg electrodes. If you assume this is negative and this is positive, you have lead 1. The left arm is negative and left leg is positive. This is lead 3, and right arm is negative and left leg is positive. This is lead 2. And this is going to be important in a couple of seconds when we explain the axis. Okay, and this is the hexaxial system all together. So this is your lead 1, 0, and stuff like this. So بعدين احنا نجي. So we attached 4 leads, صح ولا لا? بعدين we have another 6 leads we attach. Okay, and I want you to remember the positions. For their position V1 at the fourth intercostal space. So this is fourth intercostal space. Okay, V at the right side of the sternal border. V2 is fourth intercostal space at the left side of the intercostal border. The V4 يكون عادة على the fifth intercostal space at the mid-clavicular line. Okay, and V3 is something between them. بعدين عندنا V5 and V6. They're both at the fifth intercostal line, but V5 عادة على the anterior axillary line and V6 على the mid axillary line. See chat. Yeah. So I want one to volunteer to tell me how he is going to attach leads to have full ECG على the patient. So he's going to tell me where he is going to, how many leads he's going to attach and where he's going to attach it. So any takers? Yeah, like, we can say it's 9. I'll accept that. So you have to explain it. Yeah, I want somebody to come and talk. Open the mic and talk. وش السؤال؟ السؤال how are you going to attach electrodes to have a full ECG? In positions where? When how many electrodes you need to attach to have full ECG?
والليفت ليج هذه الليمب 3
هذا أحمد. So يلا start أحمد again. بس ما كنا نسمعنك أول شيء انقطع. يلا. Just repeat it. Yes. أحمد ظهر connection عندك سيء أحمد. I can't hear. في أحد ثاني يبغى يتبرع؟ في كان يوسف he wanted to talk.
اي هلا دكتور موجود.
يلا go for it.
Okay, 12 lead. We attach one in the right arm and lead 2 in the left arm. And
لا
lead 3.
لا كذا you understand it wrong. هي electrodes ما هي lead صح ولا لا؟
صح.
ايه فأنت you attach electrode to your right arm. فهمت؟ This is the first part. And then I don't see myself للأسف. خلينا نشوف هل أنا طالع في الكاميرا ولا لا. Anyways. Okay. So you attach yourself.
Doctor, it's gonna be 10 leads, 6 in the chest wall, and the 4, 1 in the right and the left arms and left legs and right legs. That's it.
Exactly. So it's 10 electrodes. So 10 electrodes, you're gonna attach them أول واحدة هنا. Usually they attach it here.
Yep.
And the end of the foot, just before, above the ankle, just above the medial malleolus, you're gonna attach one on the right foot and the left foot. The right foot we don't use it for anything, بس يعتبر نسميها just يعني base negative or a ground electroid آسف. دائما احنا نتلخبط بين الليدز والالكترويدز. بعدين عندنا 6 precordial electroids. So 6 precordial electroids, V1 على 4th intercostal space, right sternal border. The V2 is the 4th intercostal space, left sternal border. V4 is 5th intercostal space, mid clavicular line. V3 دائما you miss is between V2 and V4 on a straight line. V5 is the fifth intercostal space, anterior axillary line. V6 is fifth intercostal space, mid-axillary line. This is very important clinical skills, is you need to know how to do an ECG. عادة nurses, they do this. But you need to know it too. Sometimes you're going to be in the floor and you're going to be in the floor and you don't have a nurse that know how to do it. So sometimes you need to know. So Yusuf asked about 7 and 8. وش معنى what we say is 7 and 8 لما نقول 15 lead ECG ولا right sided ECG? What happens? أحد يعرف? So it's a good question. طيب يبغى لنا نرجع للبوردر حقنا. And I'll come back to your question, Yusuf. So I'm going to explain it a little bit. Okay. So let's go back to our whiteboard. Okay. So عندنا هذا الهارت صح ولا لا؟ Okay. So قلنا عندنا الهكساكسيال system صح ولا لا؟ يوم رسمنا how we gonna do it. مشكلة I have to جهازين. هل يأثر على الصوت؟ هل يطلع عندكم صدى أو مزعج؟ Just let me know. Okay. طيب, let's go back. So let's go back اللي هو الليد صح ولا لا؟ احنا قلنا في صدى إلى الآن. Okay, so it's gone. طيب. احنا قلنا الهكساكسيال system. So عندنا هنا your lead ايش 1. طبعا هنا your lead AVF. هنا lead 2. هنا lead 3. صح ولا لا؟ هذا الهكساكسيال system. هنا عندنا AVL. هنا AVR. صح ولا لا؟ فأنت لما تشوفها so lead 2 AVF3 they look at the heart from inferior من تحت الهارت. So these عشان كده we call them inferior leads. Okay. Lead AVL lead 1 they look at the heart from the lateral border. فهذول يسمون high lateral leads. Okay. الحين let's go back again the heart here. Okay. Let's imagine إن هذا ال chest wall. Okay. فعندك هنا V1 و V2 they look at the septum. هذه V2 آسف. Then عندك V3 و V4 they look at the anterior wall. Okay. Then عندك هنا V5 or the V6 they call them laterals. So these all also lateral. They look at the heart from the lateral side. And these 4 we call them anterior. Do we understand now how they look? أيام we need إيش? We don't see, so we see only the inferior borders for 12 limb ECG. We see the lateral borders. But sometimes you need to see the right side of the heart, this part, okay? And sometimes you want to come and see from posterior. and these what we call اللي هو 15 leads. So عندنا احنا usually 12 leads. Sometimes we call them 15 leads. How are you going to do 15 leads? Is the question Yusuf asked about. Okay, but I just want you to understand how the 12 lead ECG looks to the inferior part of the heart, the lateral part of the heart, right? So it looks here, this is lateral part, it looks here, this is inferior part, and your chest leads, it's going to look at the anterior and lateral part of the heart. So in the two parts that you can't see, there's your right side, you know, and the posterior side, you know. But what happens is, let me just go back to you need to tell me then if you need the break, let me know. Because hopefully we're not gonna. Okay, so what happens is when we do 15 leads, that just we take V4 and V5 and we put them instead on the left chest, the same place here. We put them on the right side. So we put the V4 at the fifth intercostal space mid clavicular line, V5 at the V4 and V3, and V3 here between V1 and V4, okay? And we call them right-sided 7 and 8. أيام الposterior, what we have, لما تشوف, let me see, did I have it here? لا, let's see. Let's go back. Safari. Okay. يطلع معكم الشير حق سفاري ولا لا؟ Okay, perfect. So عندك هنا your V8 غالبا على inferior tip of your scapula, okay? V7 and V9 just left and right and left to it, okay? And this is going to look at the posterior part of your heart. طبعا انت لما you move V4 V3 you put them V4R و V3R. هذول اسمهم, how you call them in the ECG. Okay, but these are not important because somebody asked, so I'm going to explain it. So I want you to understand how to do 12 leads for now. That's clear? So let's move on. So let's see more about the waves, not the placement or the electrodes. So the P wave. So P wave, sorry, let's go back. So P wave always, we have a couple of rules for P wave. They're always positive in lead 1 or lead 2, always negative in the AVR. I'm sure their duration and amplitude, you need to remember a little bit these numbers, and I'm going to explain later. So best seen in the غالبا lead 2. So فعندك الباثولوجي في ال P waves is أيام يكون عندك P pulmonale ولا atrial enlargement, you see it like this. You see it peaked P wave نسميها, which is more than how much length is 2.5. So this is very important. I'm going to give you an example, غالبا you're going to come an example and I'll tell you what's wrong with this. Then so this is the P wave represents مثلا what disease. sorry اتوقع ان كان في صدى. ال P wave which represent which disease. This is why I want you to see. بعدين عندك ال other abnormality انا اسميها ال MP wave. Well, let's go back. You're gonna see here what this is with left atrial enlargement. Here duration is gonna be long, so you're gonna have 2 peaks. So كذا بعدين يجي another peak. Okay. فهذه ال M wave. This is in the left atrial enlargement. Okay. The ST segment. So if we have an ECG, so this is you come here your P wave, but then your QRS, but then this is your ST segment. So this part from the end of the S with the QR to the beginning of the T wave is your ST segment. Your ST segment is isoelectrical or flat. ايش معنى هذا؟ معناها لما you see the PR segment here, it should be the same level with the ST segment. So this is isoelectrical. Okay, so any elevation is, we call this ST elevation above this line. You know, if your ST segment continues صارت كذا, this is ST elevation. If your C segment comes down, is your ST depression. And the J point is the junction. It's between QRS and ST segment. This is, we call it J points. So let's erase this. Okay. عبد الرحمن ويسعى ما شاء الله. Okay, so عشان كذا في ال ST segment you have different types of that comes in acute myocardial infarctions. So عندك sometimes في ال early times عندك اللي هو احنا نسميهم this is dome shaped معناها القبور. لما تشوف القبور برا تكون أيام يحطون فوقها دوم زي كذا. أو we call them the sad face. And if you imagine it's a face, that's a sad face. But this is represent acute myocardial infarction or STEMI. Okay. AM they come like علامة صح. Also it's represent acute myocardial infarction. AM it has this shape. So there's different shape for ST elevations that you need to remember. But so the most important thing is you remember is the ST elevations. You should be worried about myocardial infarction. There's طبعا يعني 10 differential diagnoses or 10 more than 10 that can cause ST elevation, but we're not going to go to this. So let's go back الحين. So the first part I introduced you with ECG, how you apply an ECG, concept حق ECG, and this part of this lecture is I'm gonna tell you how to read an ECG. And there's always a 9th step to follow. So everything is you want to see rhythm. Is it sinus rhythm or non-sinus rhythm? Okay. The second part is you want to see the rate and how calculate the rate. Third part is you're going to see the axis. But then you're going to look at the PQRS complex, the P wave, the P interval, the QRS complex. But then let's see segment changes. Just ignore the Q wave with T wave changes. T wave changes. If you go through this in a systematic way, every ECG you see from after this lecture and go on, you're gonna be a master of the ECG. So it is very important to go systematic. So we'll go and we'll get see. So rhythm عندك 2 questions and they're very simple question. Is every P wave is followed by QRS complex? Yes or no? If you see it and they say if every P wave بعدها QRS, so this is the second question is, does the P wave have a normal morphology? إيش معنى normal morphology? It's upright and lead 2 with duration less than 2.5 small square. Oral length. خلينا نشوف شكلها حتكلم في الشات. That's fine. Okay, so so this is the first step. So is it sinus ولا لا? How do I know? Is every P wave followed by QRS? Is the P wave have a normal morphology? It's simple. you look at lead 2 في P wave والبي ويف شكلها طبيعي انها duration اصغر من 2.5 ولا الامبليتيود اصغر من 2.5 if yes خلاص and every P wave is for Baker S you have a sinus بعدين بعدها يجي الريتم الريت اسف so do you know how to calculate the rate احد يعرف so anyone want to go and tell me how to calculate the rate 300 divided the number of what Abdurrahman big square divided by 300 that's true okay هذا في ايش to use this it has to be what basically 1200 it has to be sinus or regular if it's not regular how you calculate the rate anyone knows لا ما لها دخل PR بس if it's not regular or irregular how you calculate بعدين Abdurrahman he said count all QRS you mean بعدين I'll explain it. Yeah, R wave times X. So we'll explain that. So our rule تقدر تحفظها اللي هي if it's regular so every يعني it's the same so the first two rules is the same so 300 يعني this is one big square two big square between an R and R is 150 three big squares 175 60 sometimes you need to remember it or if you hate remembering and you're a math guy 300 divided by the RR interval يعني how many big squares between them okay the other part don't forget in the ECG paper is a 10 second هي 10 ثواني every ECG you print is a 10 second of the patient life okay so 10 seconds so if you calculate the numbers of R waves هناك and you divide and you multiply it by 6 اللي هي so this is going to be 60 seconds of the patient's life and that's going to be give you your heart rate so and let's go more clinical and I want one to tell me what's the heart rate here so you either unmute or you can write in the chart you have the choice so yeah let's see so this is 300 150 100 yeah I think it's more than it's 50 let's go with my 50 heart rate what's the heart rate of this rhythm in front of you so هذه 300 150 100 75 60 maybe 50 تقريبا طيب this one what's the heart rate yeah it's above 200 بس ما it's not like this يعني okay So Ahmed, he answered the right question. So it's 33 R waves. If you multiply it by 6, it's going to be 198. Right? عشان irregular. Sometimes if you look at here, it's 300 if you're going to calculate it from R to R. But if from من هنا لهنا it's 150. صح ولا لا؟ لأن there's two big squares. But عشان irregular heart rate, so you need to calculate how many R waves. في هنا 33 R waves. If you multiply it by 6, it's going to give you 198. Okay. So the axes. So how anyone knows how to do the axis? So yeah. So let's go back to the axis. Will give me 1 second. I'm gonna need the whiteboard again back again. Okay. Okay. So the axis. So there's multiple ways how you do the axis, and I hate memorization, so I need to I need to have the concept of how I look at the heart and to understand the axis. So I'll give you my way. Sometimes it's wrong, but it's not the best way for you. But that's how I think about the axis. So أحسب الأكسس and I have 4 or 4 quarters. Okay. This is غالبا normal axis هنا. This is right axis. This is we call extreme axis, and this is left axis. Okay. And how I gonna see it? If you remember كيف سوينا limb leads, احنا قلنا كيف يطلع قلنا هنا كان lead ايش 1 when it looks at the heart from the right side على 90 degrees تقريبا. This is your limb 1. هذا positive lead 1. ال AVF كان straight اللي تذكرون لما كان هنا right arm هنا left arm. هذه الالكترويدز هنا قلنا الافرج بينهم والفوت يعطي it looks at the heart of that 90 degrees. وهذه AVF هذا اللف هذا positive AVF. okay. So لما يكون عندك ايش معنى positive؟ لما تشوف ال ECG انت lead 1 you have a positive this deflection of P wave. بعدين مثلا عندك this ECG مثلا QR شوي S. Okay, so if you calculate مثلا هنا let's say this is the ECG وهنا مثلا 1 2 3 4 5 5 small squares. هنا مثلا 1 2 هذا mainly is +3 فهذا يعتبر positive. Okay, يعني your R is bigger than your S. Okay, so this is a positive lead 1 method or positive AVF. So إذا كان عندك positive, when I say positive is about I'm talking about the QRS في lead at itself. You're here, صح ولا لا? So you have a normal axis. Okay. إذا كان عندك so negative lead 1, so this is negative lead 1. What I mean by negative is you're gonna have P wave, you're gonna have small R, if any, and S, and then your T wave. Okay. So هذه negative lead 1 and positive lead AVF, it's the same thing for ECG. You're gonna be on right axis deviation. Okay. But then let's go to the extreme. The extreme is if you're gonna have negative or extreme left is you're gonna have negative lead 1 and a negative lead AVF. Okay, and you're gonna be in this quarter. Okay, and you're gonna be extreme axis تقريبا. المشكلة هنا. So here's the problem. And the first تقريبا 30 degrees out of this is a normal axis, part of the normal axis. So what happens is, if you remember lead 2, can يجي like this. هنا. So this is lead 2. So if you have a positive lead 1 and a negative AVF, you either be in a normal axis or left axis. And the one gonna conclude this, you'll need lead 2. Either lead 2 had a positive lead 2. إذا lead 2 positive معناها إنك somewhere here. Either lead 2 is negative معناها you're here, which is you have a left axis. Is it clear ولا لا? Do you have any question about this part, the axis? Do you need me to re-explain it? Okay. So last part is, okay, so the last part. Let's go back again. You understand مثلا إن إذا عندنا positive lead 1 positive AVF, you're gonna be here, صح ولا لا؟ إذا كان عندك negative lead 1 and positive AVF, you're gonna be right axis. If you have, they're both negative, you're gonna be extreme axis, extreme left axis. Okay. المشكلة هنا, so the first 30 degrees out of this is a normal axis. It's part of your normal axis. Okay. But إذا أكثر من 30 degrees, it's gonna be a left axis deviation. Okay, so well, if you have an ECG with a positive lead 1 and a negative AVF, you can be either normal axis or left axis deviation. Okay, so you need something else to see. You need to see lead 2. إذا lead 2 positive معناها إنك within the normal side. Either lead 2 is negative, يعني what I mean by negative lead 2 is you're gonna see P wave, but then you see S more than any R, S, and T wave, but it's mainly an S. So the lead 2 is negative, you are in a left axis. You're most likely in this part of the hexaxial system. Okay, so you only need lead 2 in this quarter. If your lead 1 is positive and AVF is negative, you need to look at lead 2. And if lead 2 is positive, خلاص, you have a normal axis. If lead 2 is negative, you have a left axis. Is it better or the same? Okay, we're gonna have a little bit of explanation after, so you're gonna go back and read some ECG for me. We still have an hour to go. I'll try to finish earlier, so عارف إن عندكم lecture بعد, فمديكم تروحون تفطرون تاخذون قهوة. Okay, so I need to do this. Give me 1 second. Okay, so we're and you have the same explanation, so I'll go there. The intervals you have to remember, okay? أهم شيء ال PR is 120 milliseconds to 200 milliseconds. So 200 milliseconds كم؟ How many small square? 200 milliseconds. نشوف الشات. So 200 milliseconds, how many small squares? Okay, 5. Yeah, exactly. So everyone, yeah. So this is the normal, it's 3 to 5 squares. Okay, but I just want you to understand the concept of time. Perfect. So this is your PR. So anything longer, you'll call it within first degree block. Okay. The QRS is usually less than 120. Okay, which is 3 small squares, right? The QTC is very complicated how to calculate it. So usually you're gonna see the ECG, you'll see the QTC. And usually the only number I need you to know, any number above 450 is a long QTC. Okay, that's the only number you need to memorize. So it's simple. So let's start and go systematic. So I want somebody to read this ECG for me. But I want him to read it and he'll come and talk. Just unmute himself and talk. So who's willing to try? It's normal, يعني. Nobody gonna get it all right. Don't be afraid. يعني. Nobody wanna try to read this ECG for me?
I will read it, Doctor. No.
Yeah.
There is an absent. Okay. First, the heart rate.
Okay, so what's the heart rate?
Okay. Okay. Basically, it's a bradycardia.
Okay, so what's the rate? So أول سؤال إيش قلنا إحنا؟ sinus ولا non sinus؟ صح ولا لا؟ Do you remember?
Yes. صح.
Yeah. So the first question is every P wave is followed by QRS ولا لا؟
There is an absent P wave at the lead 2.
يعني أيام DC في هنا شوي deflection. Do you see it? Do you see it?
Yes, I see the lead 1 and lead 2.
Yeah.
But the
Yeah.
last-
So basically, yeah. So there is a P wave. فهمت? It's not a normal P wave, but there's a P wave. صح ولا لا؟
صح.
Yeah. So there's these deflection. يعني it's not that very clear بس عشان كده ال ECG is hard. It's not always easy. It doesn't come textbook. You have a positive deflection at lead 2, right, with the normal morphology. So we'll call this sinus. Rate كم?
50.
50. Perfect. So let's call this sinus bradycardia, just for the sake of this. صح ولا لا؟
Okay. Bradycardia.
قلنا أول شيء yes. قلنا is this sinus ولا لا؟ بعدين next question الرate. So أول question is rhythm, rate. إيش بعدين
Axis.
the axis. So tell me what's the axis?
Positive lead 1 and positive lead 2.
Okay, that's normal axis. بس أنا شرحتها بالAVF, but it's fine. If you want to remember this way, it's up to you. So I'm happy. Okay, so this is a normal axis. صح ولا لا؟ إيه.
Then
So,
we look.
طيب بس بشرحها للشباب قبل. معلش عبد الرحمن صح؟
لا اسمي يوسف.
يوسف أنا آسف أنا ما قاعد أشوف.
عادي دكتور.
إيه يوسف. Okay. Give me 1 second يوسف بس I'm gonna explain it to الشباب. إحنا لما قلنا بالكوارترز إحنا نشوف لحظة خليني أجيب الآيباد هنا. لما قلنا في الكوارترز صح ولا لا؟ لما قلنا الأكسس قلنا نشوف lead 1 lead AVF. lead تذكرون كذا. معلش. Let's try to do it here. Okay. فهنا lead 1 هنا lead AVF وهذا negative lead AVF fault صح ولا لا؟ The lead AVF هنا if you look at it is more negative than positive صح ولا لا؟ يعني I'm in this quarter صح ولا لا؟ فالآن I need to see lead 2. So lead 2 is positive. So if you remember لحظة خليني just برسمها في مكان في النص عشان يبين. طيب let's go back هنا هذه كذا كنا نحفظ العكس صح ولا لا؟ فقلنا positive lead 1 positive AVF هنا negative AVF صح ولا لا؟ هذا الاكسبلانيشن على الشيء اللي ما فهمناه قبل. فلما نشوف ال ECG هذا lead 1 is positive صح؟ ال R is bigger. lead AVF إذا تحسبها عندك maybe 2 small squares positive maybe 4 small square negative. So mainly it's negative صح ولا لا؟ فأنا I'm in this quarter. Okay. So هنا احنا قلنا المشكلة اني I either here يا اني بكون هنا left axis deviation او بكون normal axis deviation. قلنا اللي يحدد ايش؟ lead 2. So هنا positive lead 2 هنا negative lead 2. فالآن in this ECG if you go by the way that I explained it to you, you need to look at lead 2. And lead 2 is mainly positive. So most likely I'm in this part of the axis, which is the normal axis. Okay, هذه بس عشان ال explanation the way of axes. And I like to visualize it. If people like to remember if it's positive, if this and this is positive, is normal or left, right. So I hate remembering this stuff. So I need to visualize and understand how it's done. Perfect. Asif Yusuf قطعناك. Let's go back to you. So the axis you said normal axis as you said. إيش بعد الأكسس قلنا الانtervals ولا لا?
Yes, then we look at the intervals.
Yeah. So intervals, let's say QTC is normal. The QRS, is it wide ولا normal?
No, it's narrow.
It's narrow QRS. Okay, so it's less than 100. Well, PR يعني it's maybe 3 small squares. ما يكون واضح هنا. It's fine. Let's assume the PR interval is normal. طيب. Which the next step بعدها?
The T wave, the ST segment.
ST segment. Okay.
At V2 and V3 and AVL and AVF and AVR. But first, let me explain. At the V2 and V3, there is an elevation, ST elevation. And AVF and AVF, there is a depression.
Okay.
And AVL elevation.
Yeah.
There is a mild depression at AVR, but no, I don't think we consider it a depression, this one. Okay.
So what do you have? What do you think is going on with this patient?
Okay, at the V2 and V3, it represents the anterior lateral descending artery and circumflex coronary artery.
Yeah, so the most important from الانatomy that this patient is having ايش اسمها؟
ST elevation myocardial
صح ولا لا؟
صح.
Yeah, so the management of this patient ايش بتسوي له؟
منى first ABC على طول نسوي له دكتور.
غير بعد ال ABC.
بعد ال ABC I'd give him BCL if it's less than 120 minutes.
Exactly. So you're gonna give him aspirin. صح ولا
First
لا؟
aspirin and warfarin. Aspirin for 12 months and warfarin for until the BCL is placed.
لا 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 الاسبرين you're gonna give it بس ان الاسبرين is an acute treatment. You give them antiplatelet aspirin, sometimes Plavix. Okay. كل مستشفى عنده نظام. Okay. يعني how much dose he needs. هذا antiplatelet therapy he needs something to open his coronary artery. صح ولا لا؟ So عندك two ways. You give thrombolytics or PCI. Okay, or اللي هو cath lab. So this guy, you need to activate his cath lab. He needs to go to the cath lab. صح ولا لا؟ طبعا احنا عندنا let's go back and explain. So قلنا عندنا غالبا sinus bradycardia at a rate of 50 with a normal axis. عندنا ST elevation lead V2, V3. برضو إذا you look lead 1 there's an ST elevation lead 1, right? And AVL as Yusuf said. عندنا we call them reciprocal ST depressions. So if you have anterior ST elevation, you're gonna have reciprocal ST depressions في inferior leads اللي هم lead 2 and AVF, and head to lead 2, 3 and AVF. You see, they're all there's an ST depression in all of them. Okay, this is we call it reciprocal ST depressions, and I will come to it and explain it. Perfect. أحسنت يوسف. So let's go. Let's delete this. معلش.
دكتور معلش بس في حاجة لسه ما ذكرتها.
اللي هي
في lead 2 I think we have a first degree heart block because the after the P wave there is a fixed prolonged duration.
لا ما له داعي. إيش ال first degree heart block? Explain it to me.
Okay, fixed prolongation duration between T and P wave.
Yeah, first degree AV block is your PR interval.
Early repolarization.
Your PR interval is more than 200 milliseconds. So first degree AV block, مثلا imagine this ECG, you're gonna have P wave هنا, but then you go, but then you have QRS, but then you have T wave. So if your PR segment is more than 200 milliseconds, this is first degree AV block. هذا الفirst degree AV block. Okay. إذا فهمت هنا احنا we already explained قلنا عنده sinus bradycardia, right? And إذا كان في long pause is because you're bradycardic. Your heart is contracting as 50. You have 50 contractions per minute. So there's going to be a silent there's going to be time between your T wave and your next P. But that's your rate. صح ولا لا? First degree AV block هو ال PR interval. Do you understand it? لا يعني. Don't worry about it for first degree AV block. I'll give you examples. بس إن أهم شيء بالنسبة لي إنكم go systematic. So every time. And slowly you're gonna get better. Just okay. As Yusuf said, so this is the anatomy of your coronary. So you have here your right coronary artery, okay, and here is your left main, but then it goes to left descending, left circumflex ينزل هنا. فusually إذا عندك elevation في anterior leads it's your left descending artery. إذا كان عندك في lateral is left circumflex. The right coronary is represented by these leads, the inferior leads. Okay, so this is the territory. So usually, this is, I would love you to, so I need you to remember, يعني, 2, 3 AVF are inferior, 1 AVL, V5, V6 are lateral. From V1 to V4 is anterior. I'm not going to ask you exactly which coronary. So I'm going to ask you, is this anterior MI, inferior MI, or lateral MI? Make sense? Okay. So let's go back here. So what do you think about this ECG? Somebody want to read this ECG to me? Rate or rhythm?
هلا دكتور. الو.
ايه هلا. Go for it.
طيب الريذم عندي ريجولار.
So طبعا هذا ما هو full ECG ما هو full ECG. So let's assume. So every P wave is followed by ايش؟ QRS. Let's assume this is lead 2. So the P wave is positive lead 2. So this is a normal morphology. صح ولا لا؟ يعني normal P wave. But this is, let's say, sinus.
اوكي.
Okay. وregular صح ولا لا؟
يب ريجولار.
Yeah. وش الريت؟
60.
Yeah, ما عديتها. Let's see. So تبغى تشوف P wave تيجي على اللاين على البيك. So هذه 300 150 175 60 يمكن أقل من 60 شوي. So yeah, 60 I'll take 60. Good. مش bad. So basically that's it. So is there any interval حق ال PR كم؟ So from the beginning of the P until the beginning of the R. تقريبا one big square. يعني it's 200. ها؟
or 2 big square.
لا ال PR غالبا
يب 1 big square.
one big square. So it's 200 milliseconds. So it's normal. إذا كان أكبر إذا كان 2 يعني ال P بتبدأ من هنا تقريبا. تمام. From here. Okay. Good. The QRF is less than 3 small squares, so it's narrow. Perfect. طيب واحد يقرأ لي this ECG and tell me what's going on here. مين يبغى ياخذ ال ECG هذا؟ يلا شباب. I need somebody new.
السلام عليكم. أعطنا صوت دكتور.
واضح صوت.
طيب لا أول شيء الريدم ريجولار.
Regular. Yeah. يعني is this sinus?
إيه.
تذكر questions اللي سألناها.
إيه.
Is every P wave is followed by QRS?
Yes.
Yes. Is the P wave normal morphology? Is it positive in lead 2 with duration is normal?
إيه.
Okay. So you have sinus.
ساينس
Sinus. Yeah.
الريت
Mm.
300 150 175 تقريبا 60
Okay. Okay. Yeah.
الاكسس في ليد 1 بوزيتيف، في الاي بي اف صراحة ماني عارف هذا نيجاتيف صح دكتور؟
غالبا نيجاتيف. يس.
طيب بنشوف ليد 2 بوزيتيف، مع ان ليد 2 ما ادري ايش صاير فيه بس تقريبا بوزيتيف. طالع دكتور
اوكي.
في هذه اس تي سيجمنت اللي في ليد 2 ولا؟
إيه خلاص. You're gonna say it's a normal access صح ولا لا؟
ايه نورمال اكس.
اوكي.
البي ويف قلنا نورمال. البي ار انترفال برضو نورمال.
Yeah. It's less than يعني one big. Yeah. It's يعني
إيه.
5 يعني 5 small squares.
ما تعدت ال1 بيج سكوير.
Exactly.
الكيو ار اس نورمال، ما تعدت 3.
Perfect.
اس تي سيجمنت في ليد 2 وليد 3 وليد تحت ليد والاي بي اف فيها ستيليفيشن.
Perfect.
V2 فيها ديبريشن وV3 فيها ديبريشن.
صحيح.
والاي بي ال بعد فيها ديبريشن.
So what do you think is going on?
ميوكارديال انفاركشن في الانفيريور.
Perfect. So عنده inferior myocardial infarction. فاك الله أحمد. So it's good. Yeah. I think I agree with you mostly. بس في شيء واحد أيام هنا is not clear. هذا ال ST elevation. This is can be part of the T wave. فمثلا ABF is negative وغالبا lead to مشكلته إنه مو واضح. So I think it's more negative than positive. Okay. So I think هذا غالبا he have left axis. غالبا he have left axis deviation. But that's debatable. Yeah, you can say this is more positive than negative. So يعني I don't think there's a right or wrong. But I think... So this patient have ST elevation MI, STEMI. It's very important distinction between STEMI and NSTEMI. Okay. So NSTEMI اللي هو non-ST elevation MI. This guy needs to go to the cath as fast as possible. This guy can wait. So we need to, these are killers. So if we don't treat this guy with fibrinolytic ولا cath ولا PCI, he's gonna die. طبعا وكل ST elevation يجي مع غالبا reciprocal ST depression. So we have inferior STEMI صح ولا لا؟ lead 2 3 و AVF ويجي معهم أيام reciprocal depression AV في ال AVL. So you see an ST depression here. Perfect. نشوف what's next we have. هذه difficult. So we're gonna jump this. Sorry, just let me erase this. طيب ولا let's do systematic way of reading the CCG. مين متبرع يحاول يجرب؟ يا شباب I want to read this ECG. طيب بما انك قلت انها صعبة تعال اطلع معك. You try it. عشان I'll tell you it's not hard أبدا.
السلام عليكم.
سلام.
طيب الحمد لله.
Let's go systematic. So the same thing. So the first question is every QA followed by QRS?
إيه.
Okay. Is POA have normal morphology?
البي دكتور؟
إيه POA is it normal morphology?
إيه نورمال.
وعندك ساين صح ولا لا؟ طيب الساينس الحين كم الرذم؟
الريتم
سوري اسف الريتم.
نورمال ريتم دكتور.
صحيح. وش الريت؟
مو واضح والله ما اقدر احسبها. البي صغيره.
لا الريت تحسبها من الار ويف صح ولا لا؟ فقلنا لما تشوف من ار تو ار فشوف هنا.
اي الار
هذا 1 بيك سكوير 300 150 100 يعني تقريبا 75 صح ولا لا؟ So you have sinus normal sinus rhythm صح ولا لا؟
ايه نورمال ساينس ريتم زي ما قلنا. والكيو ار اس
at the rate of what؟ شو الريت؟ كم حسبنا الريت؟
قلنا 75
Yes.
ملتبلاي.
إيه لا
اللي هو 7 سكوير عن هاف.
So around 7. بس إذا تحسب أيام يكون يعني أيام يكون 66 so it's fine. لما تحسبها بالار ويف عد 1 2 3 4 5 6 7 8 9 10 11 صح ولا لا؟ So this 10 seconds if you multiply إذا ضربتها ب6 11 ب6 بكم؟
77.
66. So the heart rate is 66. Okay, so let's move on. وش بعدين؟ وش بعدها؟
الليد 1 والليد 2 بوزيتيف.
lead 1 و lead 2 positive فايش بيكون الاكسس؟
والاي في اف بوزيتيف نوت نيجاتيف.
فمعناها انك which axis is normal axis صح ولا لا؟
نورمال اكسس ايه.
خلصنا rate ورhythm واكسس بعدين باقي الانترفال صح ولا لا؟ كيف البي ار انترفال حقك؟ normal
كيف دكتور؟
PR interval is it normal PR interval؟ لما نشوف احنا خلصنا ريت وريذم واكسس الحين البي ار انترفال.
هي نورمال نت نيرو نورمال
صح لا يعني it's not prolonged.
ايه
ما هي
نت برولونج
ما هي
ما فيها.
وعندنا نارو كيو ار اس صح ولا لا؟ ما هي وايد صح ولا لا؟ الكيو ار اس is narrow
اي
less than 3 small squares right؟
رايت.
إيه. بعدين يجينا الاس تي سيجمنت. شوف شيء غريب في الاس تي سيجمنت؟ هل في ستيليفيشن؟
لا ما في اس تي ديفيشن
ولا ستيليفيشن. yeah C wave قلنا we're not gonna discuss it C wave. okay so you'll say so this is a little bit يعني advanced ECG. this is Wellens syndrome so I'm not gonna explain it to you لأني ما بلخبطكم. okay but this is عادة I give it to the residents it's fine. طيب هذا ال ECG لا هذا both were too difficult. شفت مكي ما it wasn't very hard. you got it. طيب مين يبغى ياخذ ال ECG هذا؟ يلا. Who want to try to take the CCG?
دكتور اخذ انا.
يلا go for it. خلينا نشوف بس. أحمد يلا.
آه. طيب لا الريدم اول شيء نورمال ريجولر.
regular. والأهم من إنه regular إيش قلنا؟ عندنا 2 question في البداية.
البي ويف فولو باي كيو ار اس ونورمال بي ويف.
Okay, yeah, it's positive في اللي 2 ولا هي كبيرة. Perfect. So عندك sinus صح ولا لا؟ Sinus rhythm.
الريت 300 150 100 تقريبا 90.
Yeah, I would agree with that. تقريبا 90 شيء زي كذا. Perfect.
طيب الاكسس الليد 1 نيجاتيف اي بي اف بوزيتيف. والله نسيت وش كان هذا يا دكتور.
عشان كذا أنا برسمها مرة ثانية لأني أنا برضه
رايت اكسس ديفيشن.
Yes, that's right access definition.
اوكي. البي ويف قلنا نورمال. البي ار انترفال برضو نورمال.
Yeah, the AVF is positive and the other one is negative. صح ولا لا؟ Yeah, that's right access deviation. Perfect. A.
البي ار انترفال نورمال.
A. Perfect. Yeah, the PR interval is يعني between 120 to 200 millisecond. Yes.
الكيو ار اس نورمال.
Yes.
اس تي سيجمنت في ليد 2 ليد 3 و اي بي اف اس تي elevation فبتصير inferior MI.
Perfect.
V1 V2 V3 بعد فيها depression.
Yeah, وعندك AVL أهم شيء. هنا reciprocal is حق الانفيريور is AVL. There's an ST depression هنا صح ولا لا؟
إيه.
Yeah. So what are you gonna call the CCG?
Myocardial inferior myocardial infarction with tachycardia. لا normal بس.
Yeah. So بس الأهم من أبغاكم لا تنسون STEMI. لازم تفرقون بين ST elevation MI لأن في نوعين و N STEMI non ST elevation MI.
إيه تمام هذه بتكون ST elevation.
في elevation. طيب جانا سؤال إيش رأيك في V4؟ Yeah, maybe. Yes. V4 there's an maybe most likely an ST elevation here. But sometimes you can have more than one coronary artery blocked at the same time. حتى V6 is more clearer. صح ولا لا? There's an ST elevation هنا أكثر. Right? بس إنه mainly it looks like an inferior MI. عشان كذا خلاص. It's not going to change anything. صح ولا لا? If you have a ST elevation هنا, this guy لما يروحون الكاف they look at the whole artery. The right coronary, the left coronary. They don't depend على location. They look to the whole ECG, the whole circulation of the heart. But it's the same thing. إن في الأخير this patient have a ST elevation MI and he needs to go to the cath. length of the R wave ولا ال S wave it's important أيام يكون left ventricular hypertrophy والأشياء هذه بس I don't want to complicate things. let's be systematic و simple وبعدين انتم guys you add on. فهمت انت تقرا ايام عن ال wide QRS how to read it. فهمت مثلا تقرا عن ال left ventricular hypertrophy كيف تحسبها الاشياء هذه. Right? بس take it step by step. But now let's be simple, systematic and we'll go from there. أتوقع أن خلصنا أتوقع. Let me go. هذا ال ECG أصلا واضح، بس هذا ال ECG أنا وريتكم إياه for just one reason. للأسف if you see the PR interval, this is your first degree AV block. Do you see the PR هنا? It's more than one big square. هنا maybe clear flay 3. So this is first degree AV block. Is it clear guys? تشوفونه؟ ولا مو واضح ال ECG؟ يلا واحد أعطاني يس I guess إنكم زهقتوا، تقريبا الظاهر دختوا كلكم عليه. So بما إنكم دختوا, so I'm gonna stop here guys. Let's see. Yeah, that should be enough, I think. قبل ما نخلص, anyone have any questions? So, والله أتمنى أنكم استفدتوا, وأتمنى أن ما كانت ثقيلة. So hopefully زي ما قلت شباب, wish أنكم, so I don't know, غالبا I'll send the presentation. So hopefully you'll go through it. So most important thing زي ما قلت لكم, ال P-wave, location حق electrodes, okay, وال ST elevation, inferior, anterior, ولا lateral, okay, should be very simple, صح ولا لا, والaxis. Okay, so I enjoyed my time with you guys. Thank you so much for listening. So I guess you have a lecture برضو الساعة 10 مع الدكتور بدر اليحيى. So he's a toxicologist, so he's gonna have fun with you and you're gonna have fun with him. So على الأقل take a mental break for 15 minutes and go back. Thank you so much guys. يلا, السلام عليكم.